So welcome to all of you. Whether you're joining us live or viewing this recording at a later date, we're so happy to have you with us. My name's Naomi Hoffer, and I'm the program manager for the UCSF Sheri Sobrato Brisson Brain Cancer Survivorship Program. And this webinar is part of our monthly Living Well After Brain Cancer Treatment webinar series, which is a segment of our growing survivorship program that we've started at the UCSF Neuro-Oncology Department, thanks to a generous donation from Sheri Sobrato Brisson. I'm so glad to be with you today to discuss an important topic that impacts the lives of many of us, and especially those living with brain cancer, and that is fatigue. So we'll start with an overview of brain cancer-related fatigue and learn about some of the contributing factors and medical considerations, and then hear in detail some helpful and proven strategies that you can take to better live with and manage your fatigue. We'll also discuss some pharmacological interventions that may be an option for some. And then we'll read and answer as many of your submitted questions as we can. So please use the Q&A function to submit your questions throughout. And for those of you joining live with us now, we invite you to stay with us after the show and continue the discussion more personally together in an unrecorded segment. So now it is my pleasure to introduce our panelists for today's webinar. Alexa Greenstein is a nurse practitioner in our survivorship program who provides clinical support to patients and caregivers in our neurocognitive consultation clinic. She also co-facilitates our monthly brain tumor support group. Dr. Brook Calton is a physician who cares for patients in the UCSF Helen Diller Family Comprehensive Cancer Center Symptom Management Service, and she holds a weekly clinic with UCSF brain tumor patients in our brain tumor clinic. Dr. Calton is an outpatient palliative care specialist, a program developer, and an educator who also directs home-based palliative care services for UCSF patients. Margaretta Page has been a nurse in the UCSF Neuro-Oncology Clinic for the past 29 years. She has a special interest in symptom management with a focus over the years on fatigue, sleep disturbance, and caregiver burden. She currently serves as the co-director and nurse coordinator for the UCSF Neuro-Oncology Gordon Murray Caregiver Program. And I'm also delighted and extremely appreciative to have two wonderful and accomplished women here with us to offer a personal perspective on fatigue from their combined experience of over 23 years of living with brain cancer. Thank you all to our panelists for being here today and helping us learn more about fatigue together. I will now turn it over to them, and we'll first hear from nurse practitioner Alexa Greenstein.
Thank you, Naomi, for the introduction. Welcome, everyone, and thank you for taking the time to be with us this evening. Again, my name is Alexa Greenstein, and I'm a nurse practitioner here at UCSF in the Neuro-Oncology Department. I'm excited to present on this very important topic. With that, let's get started. What is cancer-related fatigue and why is it important? So I thought it'd be helpful to start with a clarification of the term. A variety of cancer-related fatigue definitions exist. However, one of the most frequently referenced definitions comes from the National Comprehensive Cancer Network, who defines cancer-related fatigue as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. This definition captures several key features of cancer-related fatigue. Cancer-related fatigue is different from the fatigue accompanied by everyday life because it can come without warning, last longer, and is not relieved by good rest or sleep. Cancer-related fatigue can affect you physically, emotionally, and cognitively, which can make everyday activities and tasks impossible to accomplish. Cancer-related fatigue is a well-established problem for many cancers. Similarly, fatigue is a common symptom experienced by patients of all types and grades of brain cancer. Fatigue may arise from the tumor itself, from surgery, radiation, chemotherapy, and other forms of treatment. The symptoms of fatigue can range from mild to an extreme form of exhaustion, in which fixed daily activities are brought to a halt. Fatigue is considered one of the most debilitating side effects associated with brain cancer and its treatment because of its profound effect on quality of life. Depending on which article or resource you reference, it is estimated that 40 to 80% of patients living with brain cancer will experience fatigue. It is difficult to determine the exact number because cancer-related fatigue is often underreported, and there's no one agreed upon definition or standardized way to measure fatigue. Although we don't have an exact number, the research tells us that fatigue is a real problem which needs to be addressed. Most patients will experience fatigue at some point during their medical course. Patients with brain cancer often experience fatigue during therapy. However, fatigue can persist months and years after brain cancer treatment and can fluctuate throughout the disease trajectory. The etiology of fatigue is complex, involving many different elements. Fatigue rarely occurs in isolation and is often associated with other symptoms such as depression, insomnia, and pain. Fatigue is a subjective feeling or self-perceived state of extreme tiredness or lack of energy. Fatigue can manifest in a range of physical, emotional, and cognitive symptoms. Cognitive fatigue has been shown to be particularly prevalent amongst brain cancer patients. A potential reason for this is that after the brain is injured, whether that's from a tumor, surgery, or radiation, the brain requires extra effort to think and process. This additional work can rapidly deplete one's cognitive energy. But this may not be the case for everyone because fatigue is not a one-size-fits-all. Everyone experiences and describes fatigue differently. Because of this, fatigue can sometimes feel like an isolating experience that no one else can truly understand. But you're not alone. We are so fortunate to have two panelists join us this evening to share their unique perspectives on fatigue. I'm very excited to hear how they describe their fatigue experience and its impact. So I first would like to ask
Danielle
if she could potentially share her experience living with fatigue and its impact.
Okay, hi everyone. Can you guys hear me? Okay, I guess everyone's muted. So this question, I think the question I was told to answer was, what have I noticed about changes in energy level and how has it impacted my life? And I would say, so my energy dropped off significantly. I went from one day from being extremely active to the next, struggling to walk to the bathroom. And then after a few weeks, I could get to the front door. I'm sure many of you have similar experiences. I presented with a trauma situation with bleeding and severe swelling in my brain. So had been taken down significantly. But I did over time see improvement for a while. And then at some point it just plateaued. And when we talk about energy, I think about there's really two different kinds of energy as I see it or feel it, which is the physical energy and then the cognitive energy. And I find they're kind of different but interrelated. One can exacerbate the other. And I find physical fatigue is best described as that feeling of depletion when you have the flu, or at least that's how it feels for me. And then cognitive fatigue, I can best describe to people that haven't experienced as feeling really drunk. I just am not, I don't feel safe. It's mind fog and clumsiness, and I burn myself when I make tea, I drop things, bump into things. And so I find that I have to be very conscious of where I am in terms of my energy level. So on a good day, I'd say I have a limited amount of both and can be fairly productive in that amount of time. And it's taken years for me to understand what those limits are. And then on a not so good day, or when I've pushed those limits, I feel completely depleted and it just feels like the tank is empty. In terms of how it's impacted my life, it's had a huge impact. I've given up a lot. I've made major changes to my career and my life, and it just is what it is. And I think what I found to be most important about it, though, is the mindset and how to think about it, because it can be really sad to think about all the limitations or the things that I can't do anymore, the things that I've had to give up. Or I try to shift my mindset to this idea of acceptance and opportunity and sort of resetting expectations. And I like to embrace the philosophy of Viktor Frankl, which is that even in the worst of circumstances, when much has been taken from you, you always still have a choice in how you respond to things. And so I think the key here is it's the choice to respond with a shift of mindset and focus on acceptance and opportunity and what you still can do. And I'm just going to read this quote Stephen Hawking, as you probably know, had advanced ALS and had severe disability, but accomplished great things. And I love this quote, and sometimes at those tough moments, I go back and read it. Advice to other disabled people: concentrate on the thing your disability doesn't prevent you doing well. Don't regret the things it interferes with. Don't be disabled in spirit as well as physically. Get on with what you can still do. And so I think the idea there is it can be very limiting and it can really impact your life, but there's always a lot that you still can do. And there can be hidden gifts in it as well. And I'll talk about that after.
Thank you so much. I really appreciate you being here tonight and sharing your experience with us. You really brought some great wisdom and pearls that we will definitely be hearing from later. That acceptance really is also very important. So thank you. And we also like to hear from Maite as well. Can you share maybe a little bit about your experience and how it has impacted your life?
Yes. Hi everyone. I really felt wholeheartedly everything that shared. That's a lot of what I experienced myself. It has definitely impacted my life greatly. I think the first step was for me to understand myself, what I was going through. That has been a very big deal. And really post-surgery, people expect you to, obviously you've had brain surgery, so of course you're down for the count. For a little while, there's healing, it's major surgery, and people expect you to be sleepy and tired. But my personality is really what seemed to really change. And I think for a lot of my friends and family, that seemed to be something that was surprising. It seemed like it was my personality changing. But once I was really healing from surgery, I myself started to notice that my desire to get up and get moving, I am someone that tries to live and be, I try and work out and I try and eat healthy and parent my child. My desire was there. So my personality had not changed, but rather the fatigue came with physical fatigue. I felt tired. And then there's these other components that we're talking about, this emotional and cognitive fatigue was the most surprising. I am a teacher. So when you're a teacher, people always, of course, say, wow, you must really love children. The hard part about being a teacher is that your brain has to be literally on and on well. And when you are cognitively tired, that changes things. Because if you can't really organize your thoughts very well or have the emotional bandwidth for children, that really changes the way that you operate. And so that was, I think, for me, the biggest things that I had to begin to understand. Why was I feeling tired? And some of it was physical, but baby. And that was some of the things that I noticed were the biggest change, was that I really had to prioritize for myself. How can I structure my day so that I wouldn't really run out of energy or run out of juice? Physically, as a parent, you have to get lunches ready and get kids off to school and drive myself off to work because I continued to work. And that was demanding. And then once I get to school, for a brain patient, you're already exhausted. You're tired. Your brain thinking has already been used up. The cognitive juices have been used up, if you will, and there goes the bell, and you're actually supposed to start your day. So my biggest realization was that I had to learn something new about myself and to start understanding what these things that were happening to me were, so that I can make different choices. This has really impacted my life tremendously. I really had to take a step back from teaching in the classroom with very young children, maybe moving ahead. I actually ended up working with a whole school where I went into middle school, and it almost sounds more exhausting, but cognitively and emotionally, kids don't need me as much. So I was able to save that battery juice, if you will, so that I can teach. And I was teaching Spanish. So your brain is on when you are teaching a language. The cognitive demand for you as a teacher is very high, even though I am fully bilingual. When you're teaching is a very big job. I'm sure a lot of people now have learned this, being that maybe some parents are homeschooling right now under the pandemic. So it has refocused a lot of my life just on being able to deal with who the new me was and how I could feel. And sometimes that did mean maybe not going to the gym or just restructuring a lot of what I do so that I learned that if I can save some physical fatigue and really cut myself some slack, then I was able to have more emotional juice, if you will, and I was able to tire my brain out a little more and to be able to understand what the feelings were. I noticed that because I was a classroom teacher all day, by around 3 or 4 o'clock, which is the end of the school day, I was exhausted. So that really changed the way that I had to restructure when I get home. And you're a parent, you don't get to go to bed, or do you? So I had to start kind of coming up with what can I do to improve my life. And I'm going to say, assume that we're going to talk about that later, but I did end up figuring out that if I allowed myself, a little bit of downtime, 10 minutes, 20 minutes, to do some kind of recharge, there was some method to my madness. Having a child, you have to allow your emotional battery to not go all the way to zero. Being that I have a young girl, you never know what emotions are going to come up for your children, and you have to keep going. You have to mom on, you have to have those things. And it was important for my family to learn alongside me, with me, what fatigue was doing to not just me, but to our family dynamic and to what I can do and what my own limitations were. So those are the biggest things that I noticed, was me really understanding that fatigue wasn't just me being lazy, but me really learning. It took me a few years to understand that this is my life, through brain surgery, through anti-seizure meds, through a lot of the medication that I tend to get on. Those cause fatigue. So it's very odd that then you get fatigue times fatigue, and you feel like you can literally sleep 22 hours and it still doesn't go away. There's just something very different. So my life has been impacted with education, has been the most important thing. And really for me to participate and allow people around me to ask questions. And my closest family members, I tell them, I just really can't participate in X thing because of my condition. And it's not excuse, but it's really my reality, where I have to limit myself because of this new way of life.
Thank you so much, Macy. We, again, really appreciate you coming on tonight and sharing your perspective, and your voice is so valuable, and we can't thank you enough. And this is a really good segue into our next slide, talking about fatigue's impact. So cancer-related fatigue can have a significant impact on many aspects of our everyday life. Fatigue can cause physical limitations, which can make small chores or routine tasks seem impossible to do. Fatigue can also influence other physical symptoms such as pain, sleep, and seizures. Fatigue can affect not only a person's physical well-being, but can affect their emotional well-being. People may feel sad, frustrated, and less motivated during their experiences with fatigue. Fatigue can also affect cognitive performance, making it more difficult to pay attention, concentrate, and remember new information. Fatigue can also make it difficult to engage in social activities, maintain meaningful relationships with friends and family, affect intimacy and sex life, and can interfere with employment and school. People who are suffering with fatigue may have to accept fewer responsibilities, reduce work hours, or stop working or going to school altogether. As a result, this may impact occupational endeavors and affect insurance coverage and their financial status. Feelings of weakness and fatigue can also leave people questioning their spirituality and raising questions about their beliefs and values. The impact of cancer-related fatigue on one's life is considerable, hence is why fatigue is the most distressing symptom reported by patients with brain cancer. The good thing is that there are many things you can do to manage fatigue, and your medical team is here to help you as well. I'm going to turn over to Brooke, who's going to help us understand some other factors and conditions that contribute to fatigue.
Thanks, Alexa. So as Alexa mentioned, there are a couple medical considerations for you and your clinician to consider as we work up and figure out how to treat fatigue. So one really important issue to consider is the role of mood, whether that's depression or anxiety, and how that may be influencing your fatigue. And so certainly when I do a comprehensive evaluation for fatigue, this is one of the areas that I'm really asking about. How are your spirits and how are you coping? And if I'm concerned about a mood disorder, then I usually try to treat that, given that mood and fatigue are both so interrelated. Another really important thing, which is probably a bit obvious, is the importance of sleep. So not only the quality of the sleep, are you able to get a good sleep throughout the night and sleep through the night, but also the amount of sleep that you're getting. And so this is another piece of the workup when I'm investigating people's fatigue further. And clearly there are lots of strategies to help with sleep. And if we can help with sleep, we can sometimes help with fatigue too. Another really important thing to consider is if there's uncontrolled symptoms, where if we treat that symptom as an example, if someone is having headaches as an example, and that's keeping them up at night, or even if they're just having headaches during the day, being in pain as an example of an uncontrolled symptom can really exacerbate fatigue. And so it's of utmost importance that if there are uncontrolled symptoms that you're experiencing, that we work to try to address those as well as part of the multimodal management. Doing a deep dive to think about beyond the brain cancer itself, as well as brain cancer treatment, are there other medical causes that we need to be considering? Granted, for all comers that are coming in with fatigue after brain cancer treatment, we may not be investigating all of these things, but if there's other symptoms that might tell us that another medical issue may be at play, whether that's things like anemia, or a thyroid disorder, like a low thyroid, or perhaps diabetes, then doing a deep dive to investigate whether those things are happening is important, and then controlling those will also help with fatigue. And then finally, the other thing that I would really encourage everyone to do is take a good review of their medications with their physician. So certainly there are some medicines that brain tumor patients have to be on, and some of those in and of themselves can be fatiguing, but there are lots of other medicines as well that can contribute to sedation and fatigue. And so there may be creative ways to either rotate the medicine to something else that's less fatiguing, or my favorite is just to stop things that you potentially don't need anymore, and that can help as well. So I want to just introduce a concept here, which may look a little bit similar, but is different if you take a close look at this diagram to the diagram that Alexa presented earlier. So Alexa presented the diagram of how fatigue impacts the different parts of people's lives. This concept of total fatigue is essentially that there are absolutely physical causes of fatigue, including brain cancer and brain cancer treatment, that contribute to the overall experience of what we're calling total fatigue. But there are lots of other things that I think that Gabrielle and Maite really dug down deep into and really gave us a good idea that contribute to people's fatigue. So things like people's social support, their relationship with their spouse, do they have children, and are they behaving or misbehaving? And financial stressors, which I know are a big concern to many of us right now during COVID, can certainly impact someone's total experience of fatigue. How someone interprets their experience with serious illness, having a brain tumor, having to undergo treatment, those spiritual questions of meaning and or suffering also contribute to someone's experience of total fatigue. And then finally, as I mentioned before, the psychological aspects of wellness, how someone is coping with their serious illness, or maybe going back to work after having intensive treatment, as well as potential mood disorders, will also impact fatigue. So I wanted just to take a moment and hear again from Maite and ask, what did you do to seek support to help with your fatigue?
So I looked two places, inward and outward. And for the inward, I really wanted to harness as much support as I could give myself. And one of the first things that kind of came to mind, and this is actually where I actually found a gift. We all go through life, and time just goes by, and somehow we miss things we wanted to do, or whatever. Time escapes us, and this is something, you don't have to be sick. I mean, this is just something about life. And so this is where the gift came in. When you have really limited energy, you have to use that energy where it matters and where it counts most. And so New Year's Eve for me, at a certain point, I reflected and realized, and I went on a retreat on New Year's. I started a practice, and it became more about setting intentions for the year as opposed to resolutions, and more about really getting clear, how do I want to spend my time? And I needed that structure because cognitive fatigue, when it happens to me, it's sometimes really difficult to get clear on what I should say yes to, what I should say no to, and how to use that time really effectively, organizing my time effectively. And so I found it really helpful to spend that time. It can be New Year's, it can be any time, it can be a few times a year, to just check in and really get clear on what's important. And I have two lists. I have the kind of bigger picture thing, what's more important to me in the bigger picture, and then I have kind of the more near-term things. Or bigger picture might be the coming year, and there are things that are always going to be on that list, the people that are important in my life, giving back in certain ways, or whatever it is, that are always going to be the constant. And then there's the list of the shorter term, because Maite talked about this a little bit as well, when you have such limited energy, you really have to use it well, and it's gone. And so it's important that at the beginning of the day, I prioritize the things that are going to use my cognitive or physical energy the most, and I have to prioritize that within the day. So that's my near-term to-do list. But my long-term to-do list became this thing where, instead of always having, because I needed some structure around just helping with my cognitive deficits, it helps to have that list written down. And when I'm going to say yes to somebody, I have to check and make sure, is that really a priority for me? Is that an important use of time? And by the way, on that list are also leaving time for things like serendipity and discovery and unexpected wonderful things, because I don't want to be so structured with all my time that doesn't happen. I also have to plan for the unexpected things that happen in life, because that will always happen, and you need the capacity to deal with that too. And so I would say that was a tool that has been hugely helpful for me to really get clear and check in and write that list down and use that as a check. And as a result, I found that I feel like I'm sort of, call it a bucket list, call it whatever you want, but like I do feel like I'm living my life a little bit more fully and true to what's important to me than I was before. And another thing that I think is important is prioritizing self-care and wellness. Sleep, that was just mentioned. I can't overstate that enough. And you've all probably experienced the same thing. If I don't get enough sleep, that limited energy isn't even there at all. And I start getting all sorts of weird symptoms. And so that has to be a priority to get enough sleep. I find exercise and just getting oxygen, and I find that to be important as well. And having some downtime. The other thing that was kind of my looking inward was the practice of meditation, which I found really helpful. And I'll talk about that in the next question. And then my rule number 1 is be kind to yourself, because it's really important to give yourself permission to take it easy or rest when you need to, or not to set unrealistic expectations of yourself, and to stop before you hit your limit. And I think that's really important to always keep that in mind, to be kind to yourself and not to push yourself, because I usually, if there was a limit, I was someone who wanted to push it. And in terms of myself, and I've had to learn not to do that anymore. And that's okay. It just is what it is. And then I would say letting go of things along with that, writing that list and prioritizing things. You have to be okay with letting, I think Maite talked about this too. Sometimes you just have to cross things off your list. Sometimes it's not going to happen. You're not going to have the energy for all of it. And you have to you have to allocate it where it's most important, and letting go of things. I mean, my house is messier than I'd like it to be. There's a lot of things that you just sometimes have to cross off that list, and that's part of being kind to yourself as well. And then I think I sometimes see it as, it's not saying no to things, it's more saying yes to yourself and your health and your well-being. And if you've prioritized what's important, then hopefully that takes care of itself as well. In terms of looking outward for help and support, I have a therapist that I find it very helpful to help me see the big picture of how to reduce what's on my plate and to find solutions. Sometimes I have a difficult time seeing that big picture or making the right decisions, particularly when I'm tired, particularly when fatigue sets in. So, and it doesn't have to be a therapist. I think it can be a family member, it can be a friend, it can be just somebody who you think is the right person, or I have a collection of people that offer that support to me, and it's helping me when I feel overwhelmed or when I've taken on more than I should. It's having that help to look at things and help me decide what I need to get rid of and what I need to say no to. With a therapist or a coach, I think what can be helpful is they have tools to help you in having conversations with other people or setting expectations with other people. I found that to be helpful. And in that, I've actually found that to be very freeing now that I'm comfortable telling people what I can and can't do and setting those expectations up front. It removes that potential that you're just going to disappoint people or that you're going to take on more than you can take on. So.
Thank you so much. So many really good points, and I found it particularly interesting to hear. I mean, to me, all of the things that you were talking about in terms of the internal work of weighing priorities and being kind to yourself and letting go of things that weren't as important and prioritize, all of those things are so interrelated. They all impact each other. And it takes a lot of work to do those things, but clearly it's been really, really helpful and is a really wonderful point for our audience. Thank you. And then Maite, would you mind just briefly also commenting on, I think we'll have time to talk a little bit more about behavioral strategies, of which you have both mentioned a bunch of great ones already, but just in terms of where did you seek support, that would be really wonderful to hear.
Yes. A lot of what I guess have discovered over the last decade is a lot of what Danielle mentioned. So I really felt a kindred spirit kind of in a lot of what she said. My first place that I went for support was my doctor. because, brain cancer, it's a kind of a big deal, and all the medication we're on and all the symptoms. And at the time, my husband was voicing my emotional meter had been running low, and I was having kind of like anger blow-ups, which was very much out of character. I'm normally a very lovely, nice person, and he thought that was weird. So I went to my doctor to say what's going on with me, and he explained that this was part of the fatigue, and that was hard to think about because we knew how important sleep was for me, but yet you're still trying to live. So once I got the information from my doctor that part of this new brain way of living with brain cancer means that I'm going to have these short, kind of have a short rope. Once I started to understand that, then I had to start creating space. And I have told many people, for me, this brain cancer, it is a terminal illness, and there's, sadness and scariness accompanied to all of that. But this has really been a gift for me. I was type A person who never gave enough time to myself. And this made me reprioritize and to actually learn, maybe as I'm getting older, hopefully wiser, to prioritize and to tell myself, okay, if I'm going to have such a short rope, can I have that around my 8-year-old? She was 8 at the time. She's now a teenager. And so I had to start figuring out what was my trigger. What does fatigue mean? And for me, it ended up finding support with lots of therapy. I mean, therapy, not necessarily always a professional counselor, but it came with having conversations with friends, mom friends who, they had their moments of, I'm tired because you're a parent, or a teacher friends of, I'm tired because I'm a teacher and I'm doing all this grading. But it was fine for me to hear where I was still normal, like everybody else. And then I always had to kind of remind myself and have that kindness towards myself. I had to learn to be kind to myself. I had to be very forgiving that my house is not immaculate no longer. It's messy. It's always clean, but it's messy. And that's okay. I can go to bed at 10 o'clock. I used to go to bed at 8 p.m. so that I can wake up at 4 a.m. to go exercise. And people would think that's crazy, but my exercising became a very good support place for me because exercise helped my mood. It helped my weight for me to keep, feeling good about myself. And the crew at the 5 o'clock, all those ladies at the 5 a.m. gym were just exactly what I needed to get my mood up. And I had to start making those types of exchanges, I guess, to say, I do want to go to bed at 8 p.m. and I can get up at 4 and work out. And so just having friends, having family that understands is good. And I also have felt that I have had to be okay with letting go of those that can't understand me. Unfortunately, I got a divorce. It was actually too much for my ex-husband. And that's really sad. It's a very sad thing because, kids get caught in the middle and it's hard. I'm not going to say that's the reason, but not everybody is a warrior like we are. Not everyone can handle what brain cancer does to a family because it doesn't just do it to one person. And I have lost friends over this is too much for them. And I remind myself, it's not about me. If somebody can't handle it, then there goes a priority. Then I just don't have time to explain it to people unless if they want to learn with me and be on this journey of learning all about brain cancer and how to live with it, then we're on for the ride. I have a very supportive partner and I'm thankful for him. And my daughter she's kind of dragged along this road with it. She's a very quite astute 13-year-old who I think gets to appreciate life a little more, and maybe hopefully she gains my wisdom about life and what I view life. I hope she does are my support people that I have around me. And that's kind of how I first started, was going to my doctor, going to my friends and family, and being kind to myself.
Thank you so much for everything you shared, Maite. And I just wanted to sort of reflect that from hearing from both of you, it takes a lot of energy to put together your team. And there's a lot of different places to look for support, which you have done a tremendous job of. So thank you for sharing. Yes. With that, I'm going to turn over this part of the webinar now to Margaretta Page, who's going to lead us in a discussion of behavioral strategies for fatigue management.
I'm Margaretta, and I'm here to talk about behavioral strategies that are out there to help you manage fatigue. And I just, I wanted to make a comment how nicely Gabrielle and Maite actually set my section up. It's almost as if you listened to what I had to say. You really gave some real life examples about what we're going to talk about tonight. So I'm going to talk about two categories of strategies. There are strategies to help you optimize your quality of life while you're living with fatigue. And then there are other strategies that are actually evidence-based interventions to help you treat your fatigue. So I'm going to start with the optimization strategies. And I like to say that managing your fatigue starts with a healthy dose of something called self-compassion. And you might say, how can I be compassionate with myself around fatigue? And I think the first thing is really to recognize that you are not alone, and just really say to yourself, I am not alone. We've heard tonight that fatigue is one of the most common and distressing symptoms experienced by brain cancer patients. And Alexa mentioned that it's present in up to 80% of patients. So just remember that you're not alone in this symptom. Another strategy is what we already heard these two women mention about the importance of being kind to yourself. Brain cancer related fatigue is very different than any sense of being tired or exhausted that you ever had before you had cancer. And it's not really anything that you can muscle through. In fact, I think that actually makes things worse. And so you do have to let go of the old ways of managing things. And I also just want to mention is that brain cancer is really a little bit different than other cancers when it comes to fatigue. And that's because the tumor, the surgery, and the radiation, if you had it, has actually caused a small, and for some of you, a larger injury to your brain. And as a result, it's going to take you more energy just to focus and concentrate on everyday things than it ever did before, which can add to and compound your experience of fatigue. And then in addition to being kind to yourself, I ask that you be patient. Doing this kind of work takes time. Okay, so along with self-compassion, we are going to talk about how important it is to gain an understanding of your experience. You want to understand this experience for you. And as we've already heard tonight, this is essential, and it does take a degree of commitment. It's a decision on your part, and you can either decide to do it alone or get together with your family member and really identify how it is for you right now. And that means a little bit of homework. We're going to ask or suggest that you decide to track it, analyze it, and report back to yourself. And if there are any family members out here, I just have a tip for you that I'd like to share, that the fatigue experience of a brain cancer patient is nothing like you've ever experienced unless you're a brain cancer survivor yourself. And because of the invisible nature of it, it's very easy to forget or underestimate its impact. So I invite you actually to commit to increasing your own knowledge of this invisible symptom, and then support your loved one as they adapt or update what works for them around fatigue management. So let's go to step one of what you need to do. It's track it. I'm asking you to really get a handle on your fatigue, I want you to describe it. So we say get a tracker, get a journal, a calendar, your phone, maybe just a sheet of paper to keep track of your fatigue for at least 1 or 2 weeks. And here's a really nice example of the kind of tracker that you could actually download from online, or you could use as a model. And what we want to get at is how much fatigue are you having? Can you quantify it? Mild, moderate, severe? When does it happen? Is it any time of day, any special time of day? I think it's important to begin to notice what happens when you overdo it. What helps? Maybe a nap, maybe you notice that. What doesn't help? Just good to help yourself learn what doesn't help. Here's another thing. What happens if you overdo it? How long does it take you to recover when you hit that wall? And then finally, there's this, what we call a qualitative piece, but I think it's important to understand how things are going for you otherwise. So how's your mood? Are you up? Are you down? Are you feeling easygoing, or do you get irritable when you get fatigued? And then how about your memory? How's your thinking and your problem solving? And how are your relationships? So that whole emotional piece, are you able to be engaged with your loved ones? Or are you finding that you need to be more withdrawn? And perhaps in your social life or your work, really just ask yourself, are you able to keep up? Okay, so step 2 is, now that you have tracked it, I want you to analyze it. I want you to look for patterns. Or is there anything that's happening? Is it every day? Are there any activities that cause it? What really leads up to overdoing it? Again, are you noticing that there's anything that helps it? And then finally, are there any activities that really zap your energy? And for brain cancer patients, I think this is some of those things that cause the mental fatigue that you've been hearing about. Some people notice that they get tired, actually exhausted, and even overwhelmed when they're in situations that we call sensory overload. So that is noisy, crowded, hectic environments with a lot to attend to. Now with COVID-19 and us all being home, we are not probably having as much exposure to that, but traditionally that was things like noisy restaurants, malls, maybe traveling, maybe being in an airport or a train station. However, for other people, it can be something like reading a book or a newspaper. And I have heard about people who say when they're in conversation, it's okay to be maybe talking with one person, but when you're talking with several people, that can be kind of overwhelming. And then finally, unexpected events. So sometimes things that sort of catch you off guard can really cause a jolt to your system and cause you to become fatigued. So analyze your data and really look for when is your fatigue happening and get a sense of the patterns. Okay, so after you've done that, now it's time to report back to yourself. So you're reporting back to yourself your findings. And I think this is really important. I want you to think about doing this without judgment, okay? You really need to just say, okay, this is the way it is. What can I do right now, and what I can and can't manage right now? Try not to look back and say, oh, 2 years ago I could do this. Just focus on what you can do now and agree to accept that this is the way it is now. And I think the other important thing is, just because of the way it is now doesn't mean it's going to be that way forever. It's just that's how it is. And I'm here to share with you that I think learning how to optimize your life with fatigue really begins. This is the beginning part where you acknowledge that things are different now and that strategies that worked before probably need to be updated. Okay, so how do you do that? Well, you can use those findings from your tracker and the knowledge you have about your fatigue now actually to develop a plan for yourself to optimize your energy and work towards more, if not all, good days, which usually is going to mean a day balanced with activity and rest, okay? And a fancy term for what we're talking about is this concept on this slide, energy conservation. And essentially what we're saying is that at this point in time, your energy is limited. And so it's really important to conserve it when you can so that you have it for when it really matters. So let's talk about how you could develop your own energy conservation plan. So you go back to your tracker and your patterns and you decide what's realistic. I think it helps to actually sit down at the beginning of the week and plan out your week. And you want to look at what's on the calendar. And then you want to ask yourself, what do I want to do? And what do I need to do? Okay. Maybe you want to go to your kid's school play, and maybe you want to meet up with a friend. And then maybe you really do need to get to the DMV for your driver's license. So we call this part prioritizing. And this is important. And if you can, we recommend that you try to schedule those activities that you really want to do in those times that you feel good. And that way, so you can plan to get to the things that are most important to you. The other thing, as you look at this, we think it's important to be realistic and remember that it's important to build in times for breaks or rests. And the recommendation is that you actually do this before you get tired. So again, maybe looking at your schedule, you might know that you want to take a nap on that day that you want to get out in the evening to see the school play, or maybe you'll definitely need a rest after you go to the DMV for sure. In addition, part of energy conservation is trying not to multitask, but really focus on one activity at a time. And then finally, the last thing you can do is think about what can you delegate. Now's the time to take advantage of those people who want to help. Let go of those things that really have less meaning to you and will lighten your daily load. So maybe if the neighbor wants to run to the post office or somebody wants to pick up the kids after school, I'd say that's okay. And then it's also important for you as you think about your activities, maybe there are some things you'd like to get to if everything was great and you were feeling good, but also allow yourself to let those go if needed. And examples of that might be like getting out in the garden and doing the weeding, or maybe tackling that closet you need to purge. So that's the plan, so you plan it, and then the important part, as with many things, is that there needs to be an evaluation period. So at the end of the week, as you begin to plan for the next, you do have to take a moment and evaluate how that week worked. How did it work for you? How did you feel? Were things balanced? Do you think you could do a little more? Maybe you should have done a little less. I think this is a nice opportunity. If you are living with a family member, this might be an opportunity to invite them to weigh in for you, because sometimes they see things that you don't. So they might have noticed something that would be important. I think we heard it tonight, how long sort of getting in a groove for this can take. So it's important to be patient with yourself and know that you're learning as you go. So it may take a little while. And then finally, just leave some room. I'm going to suggest maybe to leave a little bit of room, maybe to practice some of these strategies that I have that might help your fatigue improve as well. Okay, if there are any family members on, the one tip I have about this aspect of sort of the tracking and then the planning, it would be great if you could sit down with your loved one, but it doesn't have to happen as a pair. It could be just something that you notice how things go for your family, and just kind of keep that in mind when you're also for your family accepting responsibilities and activities. Maybe if you have a sense of how many are enough, that can be helpful as well. Okay, so I'm going to move on to interventions. Our top number one intervention I think is so great is movement. The truth is that movement is medicine, and our top fatigue management recommendation is actually exercise. Personally, I don't know if there's any drug that I'm aware of that has evidence that it helps with so many symptoms. Exercise helps with fatigue, it helps with mood, insomnia, cognition. We also know it helps with blood sugar regulation, high blood pressure, it helps our bones stay strong, and there's even some new emerging data that it might protect our brains from Alzheimer's. So I kind of think if exercise were a pill, it would be considered a miracle drug. And even though we all know that, why is it so hard for us to commit to that? And maybe we can commit to it, but then it's that keeping up with it. So I thought maybe one way to think about it is not to kind of think about it as exercise if it's got a negative connotation to you, but really remind yourself that movement is medicine, and it's actually perhaps a miracle medicine, and you should treat it just like you would treat it any prescription from your doctor. So I want to quickly, I'm gonna go a little bit faster on the exercise program, and if people have questions about it, we could discuss it at the end. But there is a call for aerobic exercise. It's the kind of exercise that gets your heart rate up. They suggest that you get 150 minutes of moderate exercise a week. That's a lot if you're not doing any exercise and you're tired. So we suggest starting small, maybe 10 minutes a day, and then build up. The important thing is to find things that you like and that you can do. I know that sometimes people with brain cancer sometimes have trouble with vision or balance, or maybe a leg is weak or something that makes safety an issue. So you can also think about things you can do in a gym, like a stationary bike or an elliptical might be a perfect situation. I think the big warning, 150 minutes is great, just don't overdo it. I'd rather have you start slow and then add to it. Resistance training is another thing. That's when you add weights or maybe bands to your exercise program. Ideally, we do it 2 to 3 times a week. It would probably be good if this is new to you to get a trainer or meet with a physical therapist. Just know that UCSF has a cancer, a trainer who's trained in cancer therapy, and she could help with that. And you can also get this kind of training at many gyms now. I know the YMCA has survivorship programs, and sometimes you might get a discount at the gym. So it's worth checking out. The last thing, which is my least favorite, but I'm going to say it, is stretching. A little stretching should probably happen every day. And this is also, if you don't have any exercises, you could speak with a physical therapist or a trainer who could help you out with that. Really, the key to success, I think, is finding what's going to work for you, what you like, and what might help you stick with it. So maybe it's getting to do it with a friend, or finding some good music or books while you're on the stationary bike or whatever. So try to find something that you like and some strategies to help you stick with it. Another kind of movement is yoga. And what's amazing about yoga is they're all different kinds. I count it as movement. And when we talk about cancer-related fatigue, there is a lot of data that show that this helps reduce fatigue. And if you think about it from a brain cancer patient's perspective, think about it. It quiets the mind, it stretches your muscles, and sometimes it strengthens. So I think yoga would be a great thing to try if you haven't tried it yet. It might be very beneficial. Another one I put on here, it's kind of a combination of gentle movement and meditation. There's a lot of data that shows that this work, it's called mindfulness-based stress reduction, MBSR. It's actually a program. You have to sign up for an 8-week program to learn a mindfulness practice that involves sitting meditations, body awareness, and gentle mindful movements, they call it. Really, it's Hatha yoga. It was created for patients with serious illness. And the amazing thing about this particular intervention as well is that it shows it's effective with fatigue, but it also improves stress, mood, pain, and sleep disturbance. So it's another good one. And the thing for brain cancer patients, this one, remember how we talked about overstimulation can contribute to your mental fatigue? This practice in particular has been shown to have some cognitive restorative properties, which actually allow your brain to rest. So you're getting some movement and some cognitive rest, which make it kind of a 2-for-1, I think. So that's one to think about. I put nutrition in here. There's really no magic diet for fatigue. The bottom line recommendation is for a healthy diet that consists primarily of plant-based foods with lean sources of protein. And really the goal is to get a proper balance of protein, carbs, and fat that keep you from having big swings in your blood sugar and your hormones, and then in turn your energy levels. We definitely no are high sugar snacks, because they kind of boost your energy for a moment, and then you have a big crash that's worse than where you were when you started. We recommend a lot of water. And if this is something where you feel like you need help and support on, then definitely consult a nutritionist. There are nutritionists at UCSF that would be happy to talk to you about a good nutrition plan for you. Other strategies, improving your sleep. We mentioned that, Brooke mentioned that. You've probably seen it. There's been an explosion of information on the importance of good sleep in the last 20 years. And sleep is another one that can improve several symptoms at once, including fatigue and mood disturbances such as depression and anxiety. I'm going to skim through this, and if anybody has any questions, we can talk about it. But the basic recommendation is 7 to 9 hours per night with some variability in there. I want to just go next right now, Alexa, to the tips. These are sleep hygiene. You might see this referred to as sleep hygiene, which is essentially healthy tips to promote good sleep. And so it's really limiting your naps, sticking to a schedule so that you go to bed at the same time, wake up at the same time, exercise every day, make sure you have a good environment for sleeping. Beware of hidden sleep stealers, alcohol, caffeine, and late night meals. I think the one that's sometimes surprising to people is alcohol, because everybody knows alcohol makes you sleepy, but the truth is while you're sleeping and your body's processing the alcohol disrupts your sleep architecture and you actually wake up more in the night because you've had a drink before bed. Another big one today, this is huge, turn off electronics. People have TVs in their room, their phones in their room, clocks, we have all of our, so really sort of minimizing the light is important, and any extra noise that might be in your room. And then finally, this is an easy one. I really like this one, which is ensuring adequate exposure to natural light during the day. And this is particularly important for people who might not venture outside really frequently. How many of you have heard of your circadian rhythm, which is our body's natural sleep-wake cycle? And we know that if you're exposed to sunlight during the day and dark during the night, that actually strengthens that rhythm. So if you go out for some extra sunlight in the morning, they say, maybe 10 to 15 minutes around 11 o'clock in the morning, that can strengthen your circadian rhythm and may help you sleep better. Okay, and then our final strategy, this is when an all else fails strategy. It's called distraction. And this is going to be different for everybody, but we know that feeling tired can really be discouraging and frustrating. And so the key is to kind of come up with some strategies that distract yourself. And so for some people, they might be super quiet. You might need less stimulation to be in a quiet room with a nice view. Other people might be really just okay with just a more physical rest, what we call passive activities, yet you can still do things like listen to music or read a book. The goal is to sort of take your mind off the fatigue and give you a little bit of an escape with the hope of lifting your spirits. Okay, so in summary, there are behaviors that can help you adopt and strategies that you can follow that can manage your fatigue. We talked about self-compassion. We talked about the value of understanding your experience and the importance of really getting to know it with that tracking system. And then we talked about different interventions by making sure that you get adequate exercise, maybe trying yoga. MBSR is an option. Good nutrition is an option. Optimizing your sleep is another intervention, as is distractions. And so now with that, I'll turn it back over to Brooke, who's going to talk a little bit about some of the medications we can use for fatigue as well.
Great, thanks, Margaretta. So as Margaretta discussed, there are a number of different strategies that can be helpful for the behavioral management of fatigue. And I would just recommend as a practical tip, just as you walk away from the webinar today, perhaps just think of one thing that you'd like to try in the next week. I realize that there's a lot of different possibilities. And so committing to one, I think, is always a good first step. In addition to the behavioral strategies, for some patients, there are a few medicines that we will sometimes use for really severe fatigue, particularly if it's impacting people's function and ability to do the things that they need to do. So we've talked about already the importance of treating underlying conditions that may be contributing to fatigue. There's also some medications that we'll use, like I said, which include the category which is called psychostimulants. I'll go over that in a moment, as well as ginseng. Steroids are sometimes, and then some, I will say mostly patients have come to me asking if medical cannabis is helpful. I do think medical cannabis can be helpful for a lot of different symptoms. So to the extent that it increases people's general sense of well-being or helps control pain or anxiety, because those things then contribute to fatigue, I do think it can be helpful. But in terms of the direct link between medical cannabis and fatigue, we don't know of one yet in the literature. So as I mentioned before, one potential medication for really severe fatigue that is impacting people's function, ability to work or care for their family, that is long-standing, we will sometimes use psychostimulants. So some examples of those, the most common one being methylphenidate is the generic name. The brand name is Ritalin, which you've probably heard of for kids with ADHD, but we do use it in adults with cancer or a history of cancer to help with cancer-related fatigue. Another type of medication in the same family is called modafinil. I will say we used to be really excited about the data behind methylphenidate and modafinil. Over the last probably 10 years or so, that data has now become more mixed, such that there's some studies that do report improvement in fatigue and there's some studies that don't. So it's really a coin flip, I would say. There is some data in patients with post-traumatic brain injury that psychostimulants can help with fatigue, and we don't have any particular data in brain cancer patients one way or the other. I will say anecdotally, in my experience, probably about half of my patients tend to respond. And whether or not that is a true effect or a placebo effect, it remains to be seen given how strong the placebo effect is. What I tell my patients if I'm starting this medication is that it really is not going to make you the Energizer Bunny, but it may make you feel a little bit more yourself. We do tend to avoid it in patients who have uncontrolled seizures, who have a history of particular heart rhythms, as well as uncontrolled blood pressure or certain heart conditions. Potential side effects are it can contribute to jitteriness or anxiety. We tend to see that not a ton because we're using really low doses, much lower than we use in for children with ADHD. It can have an impact on sleep, and in some people it will reduce appetite. The other medications that we will sometimes reach for fatigue include ginseng. Just a point here that the data for cancer-related fatigue is with American ginseng. The other name is Wisconsin ginseng at about 2 grams a day. So I always encourage my patients that it really, with a lot of medications that we use for symptom management, it's often less about the medicine you choose, but how you're using it. And so the dose here seems to be important. It is over the counter, so you could get it at Walgreens or CVS, but I would absolutely not recommend starting it without talking about it with your doctor. There are some important drug-drug interactions to consider. It is sometimes not safe for folks who have bleeding or clotting disorders. And it also is sometimes a medication that's not allowed under clinical trials. So that would be a consideration as well. Finally, some of you are probably familiar in general with steroids, having been on them yourself or or knowing other people. For patients who are really struggling with fatigue and often are nearing the end of their life, we will sometimes use steroids to help with a variety of symptoms, of which one of those is fatigue. Lots of possible side effects if used long-term, and so that is a consideration and something that we're careful about.
Well, thank you so much, Dr. Brook Calton, as well as Alexa Greenstein, Margaretta Page, and a special thank you to our 2 survivors for their wonderful personal perspective. We do have time for just one question, and it is directed to our 2 survivors. This person is looking for high-level advice for someone who's maybe new to this disease and just really suffering right now from fatigue. What kind of high-level first tip would you offer them? Danielle, you want to start with that?
I would say 1 foot in front of the other. and do not try to put timelines on things, and just live minute to minute, day to day. And again, that go back, be kind to yourself and just be open to what happens. I think there's not, otherwise you're wasting your energy on something that you just can't control. And I found that that meditation really helped. I took that mindfulness-based stress reduction class that Margaretta talked about, and I found it really helpful. And I just found it helpful with awareness around paying attention to these things and being able to accept things as they are.
Thank you. Maite, how about for you? You're muted right now. Let's unmute you. Great, thanks.
There. I would say the same thing. I would say congratulations that you're already listening to this. That's more than I knew 11 years ago. So you're already ahead of the game by getting information, by asking other people questions, and really just go to sleep. Go take a nap. It's okay. Things will get done. Don't worry about dishes. Who cares about your house? If people come visit your house, they're probably coming because they care about you and they love you. And who cares about their house? If they don't want to see their dirty dishes, tell them, can you please do my dishes? And be okay with that. And I would say, just like I said, one day at a time, be kind to yourself, realize what has just happened. Maybe you've just had surgery or you're about to have surgery. It's a big deal. So I would just say, just take a deep breath and you'll get there. Take a nap, eat the right things, even though you want to eat a bunch of sugar and a bunch of chocolate. Don't do that. Try and get as healthy as you can, and maybe today's exercise might be a very short walk. At least it was a walk. And drink water.
Beautiful. Can I say one more thing? Yeah. How very lucky the patients and survivors are now to have this program and to have all of you. Maite and I didn't have that.
Right.
And so I think we kind of had to figure this stuff out. But, and I mean, Margaretta, Brooke, Alexa, Naomi, I mean, this is so wonderful. And Margaretta, as you were going through all your coping things, what's amazing to me is and it's been said on this call, nobody can really understand what it feels like unless you're experiencing it. But my gosh, Margaretta, you explain it and put it into better words than I ever could. Right. And I think that's someone who has been working with brain tumor patients for so very long. She was at UCSF. She was a nurse. She wasn't working on this program, but that is someone who has years of experience with patients and is listening to patients. And that is expertise that is worth its weight in gold, to have someone like that leading this effort and really understanding what we need and what would help. It's just remarkable. So thank you, all of you.
Thank you. Thank you so much for saying that. That's a lovely note to end on. And I want to once again thank my panelists so much for being here, for all of your words of wisdom and support to all of us on this journey. And I want to let you know that we are going to do the after the show, so I'll let you know how to stay for that. We'll stop the recording right after this, and we'll continue the conversation and hear from you if you want to share what worked for you. And we'll continue to talk to the panelists as well. And the last thing I wanted to let you know is that our next webinar will be on fear of recurrence and managing fear of recurrence and scanxiety, which I know is also something that's very prevalent and very real for many of you watching. So thank you again. Thank you all for joining us live. We hope to see you at the next event or webinar.